Good afternoon. Lunch and health has a very close connection. Uh, Less you eat, healthier you are. Less you eat dessert, even more healthier you are. Slower you eat, your health improves even better because your digestion improves. And it's always a challenge to start the first session, but I'm really glad the first session is going to be on health. And I'm absolutely thrilled to be here, especially talking about sustainable healthcare. And I want to start with one statement. In 1978, Alma-Ata, this was in Kazakhstan, when the global health summit happened, there was a declaration that was done by global health, by all the governments as well as health organization, that by year 2000, we will reach health for all goal in every country, for every human being. And we come to year 2022, and last 2.5 years, we have seen what happened. We saw how inadequate we were in terms of managing health and how challenging it was to meet the requirements and fighting the disease like COVID. And naturally, I think this has really put a huge challenge, right? On a sustainability goal for the planet, health is one of the top goals. Without a healthy population, you will not really grow a sustainable economy. And to build a healthy goal, UN has also put together goals on healthcare. Health for all, good health for everyone, and this becomes the global challenge. And for Siemens Healthineers, this is core to us. Sustainability without really managing the challenges of healthcare is not going to really lead us anywhere, and we need to really make sure sustainability in levels of technology, in levels of human health, in levels of bringing long-term social health sustainability. And I want to talk about this piece. Look at the numbers. Numbers of people who die of different diseases. And if you look at 3 of the big circles that you see, the bubbles, they talk about cancer, cardiac, as well as neuro diseases contributing to the majority of the deaths worldwide. And there are, of course, many times we tend to think that there are many people dying of accident, but that's a small dot somewhere. But these big diseases are killing the world and actually making the life or healthcare not as great. Care is disjointed because there are so many diseases, so many specialists needed. You're not able to really provide insightful healthcare solution to anyone, and that really brings in a challenge. Excess is unfair. I like this statement, where you live cannot decide if you live. And unfortunately, today, that is a situation. Where you live decides if you get a good health care or not, and that decides if you live or not. But the good news, knowledge is accelerating. Knowledge is accelerating at a very fast pace, and today the healthcare data is doubling every 73 days. That's a great news. But the bad news, there was a study which was done in terms of how much is a wasteful spend on medical care in US alone. If you look at it, the wasteful spend is to the tune of $600 billion to almost $1.9 trillion in US alone. And if you put together this number for the rest of the world, this goes in several trillions of dollars. I mean, that's a huge waste. Now, this waste, why is it coming? There are a lot of unnecessary tests that happen. There are a lot of clinical decisions that are made wrongly. There's overuse of drugs. There are administrative waste. And there are many people who actually go at a very late point to really get themselves treated. Now, how do you eliminate this waste that can really bring sustainability? And this is another way of looking at the waste that comes in the entire healthcare system. Diagnostic variations, you take an image of a person who is breathing fast versus someone who is holding his breath, well, there is going to be a diagnostic differentiation. And how do you really bring that accuracy to diagnosis? How do you bring craftsmanship of medicine to the core so that people are able to manage the healthcare decisions better? Today it is left to the skill of a doctor. But can you make skill to be important, but provided with a lot of support that can really make it better? Transparency is very poor. I was speaking to one of the doctor recently, and he told me that most of the deaths in ICUs occur at 5 a.m. in the morning. Actually, it is not that the patient dies at 5 a.m. because there is not much care given during the time after 11 p.m. till 5 a.m. No one goes near the patient to check their status because patient gets angry to go and check his vital statistics. And when the death occurs, it is too late. So these are real challenges that need to be managed. But even look at the other challenge. The population is increasing from 8.6 to 9.9 billion by the year 2050. But there is going to be a shortage of nearly 18 million healthcare staff, technologists. But the good news is the computational power is increasing and the internet accessibility is increasing. Look at India, how the internet became a household name and how the digital solutions on financial became everyday name. So if you think about it, challenging times in healthcare need absolutely innovative solutions for sustainability. And this is where we are thinking in healthcare, especially from Siemens, on three aspects. One is, how do you bring precision to medicine? Precision diagnostic to me is, if simply put, is all about how do you detect disease correctly and how do you detect disease in time. And second piece is looking at creating a digital twin. All of us who see Bollywood movies, we are all familiar with what a twin can mean. You pinch one twin, the other twin gets the pain. In healthcare, we are talking about digital twin where you pinch a digital twin and you can feel the pain, or it can tell you where it would pain. And that's exactly what we are trying to look at. What Google did for maps. Google talked about creating maps where you are able to know where exactly you are and how is it mapped. And in human body, we are looking at creating a mapping that will help us detecting diseases correctly or organs where they are, where the tumor, how do you really look at it? And you navigate using Google Maps to see where do you travel, what is the estimated time of arrival. Can we do the same thing in healthcare? Yes, of course. We can do the same thing in healthcare by looking at how do you treat cancer through radiotherapy in a way that can really treat it correctly and properly. And the last piece, when there is a traffic, in Google Maps, it gives you alternate paths. Now in healthcare, when you are doing a surgery, can we provide alternate treatment that can immediately help us go to the right level of treatment? And that exactly is what we are looking at. Now, digital twin is going to help us get there, but today we are all about automation. How do you make surgeons or clinicians' job easy? Tomorrow is all going to be about intelligent algorithms that will help us get to the point where you are able to detect if a person has certain disease. Bring the element of history to the patient diagnostic. NDHM is a great way of looking at it. National Digital Health Mission will drive collection of data and creating a historic direction to the patient health. And tomorrow is going to be all about digital twin, which will help us navigate for our wellness management, not just disease management. And this is where we are excited. And we in Bangalore have also made a decision to create a very sustainable healthcare innovation center that will drive the next level of innovations coming out of Bangalore. This is a zero carbon footprint which will drive the future. And lastly, I want to say with one small story about in China, there's a practice of having family doctors. The family doctors are paid annual fees. And the annual fees are based on how well the family is kept healthy during the year. They are paid at the end of the year. And if any person falls sick during the year, there's a deduction in the fees. So they are incentivized to pay for wellness, not for disease management. And that is going to be our future, to look at disease management. And we are excited that will bring a huge amount of sustainability in healthcare. Thank you.